Hi, Dr. Dave here to talk to you about anal fissures. I know, not the most glamorous of topics, but I'm a colorectal surgeon, so my glamour days are pretty much over. If you've ever had a fissure, then you know that this is no laughing matter. An anal fissure is a cut or split in the anal opening. It's not big, but since there is such a high concentration of nerve endings right in this area, it can be incredibly painful, especially when you have a bowel movement. Ouch! It's often confused with a hemorrhoid, but it's not the same thing and is treated very differently. So for some of you that have been treating what you thought was a painful hemorrhoid and are not getting better, keep watching. You might just have a fissure. I'll go over how someone gets a fissure, what the symptoms are, how I treat it, and how I can tell the difference between a fissure and a hemorrhoid. I'm a colorectal surgeon in Denver, Colorado. I work with Denver colorectal specialists. I trained at the Mayo Clinic, and I've been treating anal fissures for over 25 years. So scrub in with me, Dr. Dave, as I go over yet another annoying pain in the butt, anal fissures. So a fissure means a cut or split in the surface, and in this case, it's in the anal canal. Here's a diagram of the anal canal, and this is what's called the dentate line. This is where the lining of the rectum and the skin of the buttocks meet. Anal fissures occur here in the skin-bearing tissue below the dentate line. This is where all the nerve endings are, and this is why it can hurt so badly. Okay, so wait, is the fissure on the inside or the outside? Great question. This can often feel like it's up on the inside, but it's not really on the inside or the outside. It's actually kind of in the doorway between the two. It's important to understand this point because if you're putting medication on this area, you might be putting it in the wrong place and not getting it where it needs to be, which is why it might not be getting better. Also, this can be a tricky area to see, which is why it can be difficult for a doctor to diagnose a fissure. So how does someone get an anal fissure? Well, most of the time it occurs from a larger than normal bowel movement, which causes the opening to stretch and tear. Now, I see this frequently in people that are on pain medications, which can be very constipating. I also see in people after traveling.
Really? So how does traveling cause constipation?
Well, most of the time when people travel, they're off their game, so to speak, and they don't eat well, they don't drink enough water, and let's face it, they don't like to use, let's say, an unfamiliar bathroom. Holding it in for even just a few days can cause a backup of waste, which can be painful to pass when eventually they do go to the bathroom. And really, anything that causes constipation, such as dehydration, low fiber diet, or lack of exercise, can set you up for a fissure. It hurts because the opening is tearing. Now, this happens from time to time in almost all of us, and in most cases, the tear will heal up quickly, sometimes within a day or two. But when it doesn't heal quickly, a fissure develops. So I'm going to talk to you about the symptoms of a fissure, and then I'm going to go over how to treat it. And pain with a bowel movement is the most common symptom of a fissure. The pain is often described as feeling like a cut or kind of feeling like passing a piece of glass. In severe cases, it can be excruciating. Now, this pain can occur just while having a bowel movement, or it can last for up to hours afterwards. The fissure then exposes the part of the muscle underneath called the internal sphincter, which can then make it go into spasm, and that can cause the pain to last longer. The spasm also makes it harder to go, which puts you in this horrible loop of pain, spasm, harder to go, pain, spasm, harder to go, and that will in turn make it really hard to heal. Now, it's also common to see blood when you go because of the skin tearing. Sometimes it's a lot of blood. Yikes. I guess this is a hazard of the job because there's a generous amount of blood vessels in the area. But as always, if you see blood, don't ignore it. Don't diagnose yourself. Get it checked out. So how do I figure out that this is just a fissure? Well, doing an exam in the office is critical. This is the best way to tell the difference between a hemorrhoid, a fissure, an abscess, or something worse. And though tumors in this area are far less common than fissures, it's important to make sure that this is not what's going on. Because of this unique location, a fissure is frequently not seen on colonoscopy. The scope just doesn't see the anal canal well.
Really? It seems like it should be able to see the anal canal well.
True, but unfortunately it just doesn't. And also, the fissure can cause swelling around the edges, which often is why it confuses people and makes them think they actually have a hemorrhoid instead of a fissure. Please remember, not everything that sticks out down there is a hemorrhoid. Okay, so how do I treat an anal fissure? Well, medical treatment involves 5 things. 1, soften the stools. Take an over-the-counter stool softener twice a day. Now, this pulls water from the colon into the stool to make it softer. 2, drink plenty of water. This will naturally make the stool softer. 3, try to make the movements more regular by increasing fiber in your diet or by taking an over-the-counter fiber supplement. 4, try to relax when going. Now, when it hurts to go, it's natural to tense up, which actually makes it harder to go and can make the tear worse. It can also help to soak in a warm bath, which will make it feel better and will help relax the muscle, which is in spasm from the tear. This spasm contributes to the discomfort and the difficulty with going. And finally, number 5, To treat the spasm, I often prescribe a topical muscle relaxant. Topical means in the form of an ointment or cream. The three most common ones used are nitroglycerin, diltiazem, and nifedipine. These work by not only relaxing the muscle, but also by dilating the local blood vessels and allowing blood to get to the area and help it heal. It's critical to apply this into the anal canal.
Man, you're really harping on this anal canal anatomy.
Well, yeah. I need to. If it's applied just on the outside or too far up on the inside, it won't be as effective. That's why I typically don't prescribe suppositories, because they go too far inside past the fissure and aren't as effective. The ointment is best applied either with a fingertip or a cotton swab. Following this protocol, stool softener, fiber supplement, soaks, relaxing when going to the bathroom, and applying a topical muscle relaxer will frequently get the fissure to heal up in 2 to 4 weeks. Now, even after 4 weeks, if it's not healed but is improving, I would recommend continuing with this regimen. Okay, so what if it doesn't get better or it gets worse? Well, then what? Well, then we may need to consider surgery. I realize nobody wants surgery, and there's no harm in continuing with medical treatment as long as the patient wants to keep trying to avoid surgery. But ultimately, the decision on surgery comes down to how bad the pain is and how much they can tolerate. Now, when it comes to surgery, let me go over the 2 most common procedures. The first involves injecting Botox.
Wait, really? Botox?
Yeah, Botox into the sphincter muscle. This is quick and has very little long-term risk, but unfortunately it's not always successful. It works about 60 to 70% of the time. The Botox paralyzes the internal sphincter muscle. That's the part of the muscle that is in spasm and causing the pain. Realize it can take several weeks to see improvement. The other common surgery is what's called an internal sphincterotomy. This involves cutting a small amount of the edge of the internal sphincter muscle to get its tightness back to normal. This is successful up to 95% of the time and can sometimes take only a few days to see results. Now, it is a permanent cut, and though uncommon, a weakness in the muscle can occur. So all of these things have to be considered before deciding on surgery, but I will say that a majority of my patients tell me soon after surgery that they wish they had done it sooner. That's how successful this surgery can be. Okay, and one last note. I also see fissures frequently in women after pregnancy. Though hemorrhoids are much more common than fissures during pregnancy, after delivery, pain with bowel movements is more commonly due to a fissure, especially when nursing if they're not increasing their water intake. And again, the swelling that occurs makes many believe they have a hemorrhoid when they actually have a fissure. But fortunately, after pregnancy, most fissures respond to medical treatment and don't require surgery. So remember, if you think you have a fissure, see your physician to be certain. Then make sure you drink plenty of water, take a stool softener, eat your fiber, and if needed, use a prescribed topical muscle relaxer. I hope you found this video helpful. If you have any questions, throw them in the comments below. And tell your friends that you scrubbed in with Dr. Dave today and learned all about fissures. And I hope to see you in my next video.